Now let's look at the differences between grief and depression. What you first need to understand is that the other name for grief is bereavement. So grief and bereavement are exactly the same thing. So what we're looking at is an individual who's experienced a loss, someone that they love, like, admire, etc. So it is very normal for them to exhibit symptoms. Their mood is going to be down. They're going to have sleep problems. They're going to have weight problems. They're going to have energy problems, concentration deficits, attention deficits. So the symptoms are identical. The main difference is that in grief, you have good days, you have bad days. In grief, you are going to have the symptoms lasting for less than 1 year. And in grief, you're still functioning. The moment the symptoms move past that 1 year mark, the symptoms then, even though they're identical, the diagnoses will change. So it's not grief anymore, but it's major depression. So the way we treat grief is with supportive psychotherapy. Why? Because patients tend to get better. And the way we treat depression will be with antidepressant medication, because we're assuming that after 1 year of the loss, if you are still having symptoms, chances are you're not going to improve on your own, and we have to be very aggressive and treat you. So the treatment of choice there will be antidepressant medication. However, if the patient were to have thoughts of suicide or actually attempt suicide, it would not be called grief, but it would be called major depression, and we're going to treat it with antidepressants. Now, after a woman has given birth, there are a series of things that can happen to her. One of the things that can happen to her is nothing. She doesn't exhibit any kind of mood changes whatsoever. But what most commonly happens is that these women experience what is called the postpartum blues or the baby blues. The women can also experience postpartum depression or the postpartum psychoses. Now, are these changes, are these mood disturbances occurring because of hormones, or are these changes occurring or mood disturbances occurring because of underlying mental illness? It could be a little bit of both in some of them, or it could be one or another in others as well. So for example, you've got postpartum blues or the baby blues. These symptoms usually begin immediately after the woman has given birth, and they usually go away within 2 weeks. And this can occur with your first baby, your second baby, your third baby, your fourth baby, and anytime you have a child, you may exhibit the same kind of symptomatology. So what does that indicate? It probably indicates that these changes are occurring, these mild depressive symptoms, where you're weeping, where you might be irritable, where you might be having some problems with your sleep, tend to be self-limited. They're probably hormonal. You're going from one state of pregnancy to a state of non-pregnancy. That shift in hormones is what's going to cause the mood changes. Most women experience this. It's very common, and it's self-limited, so no treatment is necessary. And of course, none of these women ever have thoughts of wanting to hurt their babies. Postpartum and depression and postpartum psychoses could actually be different. Postpartum depression and postpartum psychoses could have something to do with a hormone shift from pregnancy to non-pregnancy, but probably most of these occur as a result of women having an underlying mental illness, whether they have depression or bipolar disorder or schizophrenia. So these are women, of course, who have some mental illness. After they have given birth, usually within a month, they will either exhibit A, depressive symptoms alone, and that would be the postpartum depression, or B, psychotic symptoms and or mood symptoms, and that would be the postpartum psychoses. Now, because these symptoms are severe enough where the woman is affected, her level of functioning is affected, and you have to make sure that the baby is safe. Make sure that the baby is safe. Make sure that the mother doesn't have any thoughts of hurting the baby. If any woman is going to hurt the baby, chances are it's going to be a woman who has a diagnosis of postpartum psychoses. They're more likely to do it than those women that have postpartum depression. The cause of postpartum depression are usually women who have underlying depression. So the treatment will be, given these women, antidepressant medication. Postpartum psychoses, on the other hand, are women who probably have an underlying bipolar or an underlying schizophrenia. So the treatment will consist of either giving them mood stabilizers or antipsychotics or antidepressants given the bipolar disorder that they have as their underlying disorder. So always make sure that the babies are safe and that these women are also safe and they're not going to hurt themselves. The stages of death and dying were first created by Elizabeth Kubler-Ross, and what was important about these stages is that they're not specific to death and dying. These are things that can happen to anybody when they go through anything in their lives. For example, getting a divorce, getting fired, any other situation can trigger these stages of death and dying. And what's also important is that they do not have to go in order. So let's review these stages. Stage 1 is shock and denial. You've just been told you have some kind of illness. What could happen to you? You're in disbelief. You want a second opinion. You want another biopsy. You want to go to another doctor. This is followed by stage 2, which is anger. Why did you have to get this disease? Stage 3 is a bargaining. You're now wheeling and dealing. You become very religious. You go to the churches, the temples, whatever. You start to pray periodically as you're trying to bargain your way out of having this illness. Stage 4 is a depression where you go through the signs and symptoms of depression. And stage 5 is an acceptance where you finally realize that you have a disorder and you make the preparations for this disorder. But remember, what is essential is that they do not have to go in order, but memorize them in order. This is the classic question based on Elizabeth Kubler-Ross's theory. A 32-year-old woman was recently diagnosed with breast cancer. Which of the following would you expect to see first? A, shock and denial. B, anger. C, bargaining. D, depression. Or E, any of the above. Most people would answer A, shock and denial. Why? Because it's the very first stage. However, the correct answer is E, any of the above. Remember what I told you, they do not have to go in order. So this is a woman who could have had a very strong family history, understand that whatever she felt in her breast was probably breast cancer, and accept it. But maybe the next day she calls the doctor and says, what if you made a mistake? I want a second opinion. So any of the above is usually the correct answer when they make you choose what would be the expected first one if any of the above were there. If any of the above were not there, then of course it would have to be following the stages in order, and therefore A would be the correct answer should any of the above not be there.